today's ceremony a reality. Thank you very much. Thanks.
Please, you are jamming those hands together, jam them properly for the Provost, College of Medicine. Distinguished guests, ladies and gentlemen, permit me to make welcome the Registrar, African Institute of Public Health Profession, person of Dr. Bankole Ayodele. You're welcome, sir. And of course, our guest lecturer for today's induction, person of Dr. Okunnuga Ndidi, Aishat. We also acknowledge the presence of the head of Department, Public Health, a person of Dr. A.B. Akinola. You're welcome, ma'am. Ladies and gentlemen, without further ado, to move us swiftly into the program of today, permit me to make welcome to this microphone to read the citation of the guest lecturer. Ladies and gentlemen, a round of applause for Dr. Oluwa. Thank you, ma'am. A round of applause for Dr. Oluwagbemiebo as he comes to read the citation of the guest lecturer.
Standing on the existing protocol, I hereby request Dr. Aishat Okunnuga, Ndidi, to stand up and remain standing as I read her citations. Dr. Aishat Okunnuga, Ndidi, was born on 17th June 1977 in in Oderili, Ondo State, and she is happily married with 3 children. Her educational background: Dr. Aisha started her early career in education in Our Lady of Apostles Primary School, Yaba, Lagos State, Nigeria, where she obtained her primary school leaving certificate, LSC, between 1984 to 1989. She started Onike Girls High School, Onike, Yaba, Lagos State, Nigeria, where she obtained her senior school certificate, SSC, between 1990 and 1995. She furthers her education at the College of Medicine, University of Lagos, Idiaraba, Lagos State, Nigeria, where she backed up with bachelor's degree of medicine and surgery, MBBS, between 1997 and 2003. She later went to National Postgraduate Medical College of Nigeria, where she obtained the degree of FMCR in November 2012. She went to West African College of Surgeons, where she obtained the degree of FMCR in April 2013. She obtained the University of Washington. She attended the University of Washington, USA, to obtain diploma degree of FMCR in September 2018. She attended the University of Harvard to obtain a diploma in public health in September 2020. Membership of professional bodies. Dr. Aishat is a bona fide member of the following professional bodies: National Medical Postgraduate College of Nigeria, West African College of Surgeons, Medical and Dental Council of Nigeria, Nigeria Medical Association, Ondo State, National Cancer Society, Cancer Education and Advocacy Foundation of Nigeria, Association of Radiation and Clinical Oncologists of Nigeria, Medical and Dental Consultant Association of Nigeria, Breast Cancer Association of Nigeria. appointments and work experience with dates. Dr. Aishat, as a medical officer, she served her rotating internship at Lagos University Teaching Hospital, Idiaraba, Lagos, between September 2023 to September 2024. As a National Youth Service Corps member, she served at Primary Health Care Center, Ojo, local government, Lagos State, between 10th March 2005 to 9th March 2006. As a qualified medical officer, she worked at Agape Medical Center, Ikpaja, Lagos State, between 2005 to 2007. Dr. Aishat received her residency training in radiation oncology at the Lagos University Teaching Hospital, Idiaraba, Lagos, 2007 to 2012. As a consultant radiation and clinical oncologist, she worked at State Specialist Hospital, Akure, between March 2013 to August 2017. As a consultant radiation and clinical oncologist, she is working at the University of Medical Sciences Teaching Hospital Complex, Akure, from August 2017 to date. As part-time lecturer 1, she worked at the Department of Radiology, University of Medical Sciences, UNIMED, Ondo State, Nigeria, between August 2018 to 2020. As a senior lecturer 2, she worked at Department of Radiology, University of Medical Science, Ondo State, Nigeria, from September 2021 to date. Dr. Aishat is currently the head of Department of Radiation Oncology, UNIMED. Between October 2019 to date, Chairman Drug Committee and Management University of Medical Sciences Teaching Hospital, Akure Complex, to date. Clinical facilitator for cervical cancer elimination program by the Ministry of Health, Ondo State, WHO, and CHI, an NGO on cancer initiative, from 2023 to date. Head of training, University of Medical Sciences, Teaching Hospital, Akure, Ondo State, Nigeria, from April 2024 to date. Deputy Director, Institute of Advanced Clinical Studies, University of Medical Sciences, Ondo State, 2024 to date. Publications. To her credit, she has published several journal articles of both local and international standards. She has also published books and contributed to many books. Today, it is an honor and my pleasure to present to you all a distinguished scholar, Dr. Aishat, an erudite scholar. Your expertise in the field of public health is renowned. Your critical thinking, creativity, and passion for the profession, and your commitment to mentorship and academic integrity are inspiring, as this has made a lasting impact in your student colleagues and the broader community. Dr. Aishat Okunnuga, Ndidi, we are proud to have you.
Thank you very much, sir. Thank you so much. Please, let's have our seats. Thank you very much. Thank you. Thank you, ma'am. Thank you. Thank you very much. Thank you for having me here. It's a great honor. Let's have our seats. Thank you very much. Sincerely, I'm really elated to be here. I really want to, and I want you to know that I'm not taking it for granted. So I want to say good morning to all my officers. I say good morning to our pro-chancellor and also the VC of this great institution, Professor Molala Inoye. Thank you so much, ma'am, for the honor. Also, I recognize the Deputy VC, that's the person of Professor Yesoji, the Registrar, African Institute of Public Health Professionals, that's in person of Dr. Ayodele James, Dr. Ayodele James, The provost, my daddy, immediately I came in, I was looking for him. The Provost, College of Medicine, he is my teacher and he's still my teacher. Professor Joseph Fatukasi, thank you so much, sir. All distinguished guests, all principal officers of this great institution, professors, lecturers, staffs, parents, well-wishers, and of course, our beautiful inductees. I sincerely appreciate this honor to be here this morning to give this lecture, Innovating for Impact, Embracing the Unknown in Public Health. By way of introduction, because most the inductees here are public health graduates. So when we say public health, it is the science and the art of preventing diseases, prolonging life, promoting health of people and their communities. And we all know that there are different aspects when it comes to public health. When you talk about prevention, promotion of healthy lifestyles, population focus, evidence-based practice, interdisciplinary relationship. Public health is a very special area in medicine because they have this interaction with virtually all the departments when it comes to health delivery, healthcare delivery. Now, what are the unknowns in public health? Because that's why we are here this morning. Public health is constantly facing a lot of challenges. And as we speak, we keep having several challenges coming up. And we give an example of infectious diseases like the monkeypox. We know that the monkeypox is now around the corner. And even Lassa fever, which is endemic in Ondo State. We have old diseases returning with resistance, antimicrobial resistance, climate change and environmental health, increase in non-communicable diseases like cancer, hypertension, diabetes, and even mental health. Also, we have health inequalities. We all know that not everybody is getting the adequate and the standard health care they desire. Misinformation and lack of trust. Urban overcrowding. We realize that people are moving from rural areas now to urban areas. And the urban setting is now being overcrowded. Rapid adoption of digital health and data privacy. Now, embracing the unknown. We need to embrace the unknown we are talking about. And when we say embracing the unknown in public health, we are simply saying that we should accept that uncertainty is a part of progress. It involves accepting new ideas, approach, and modern technologies when it comes to managing and healthcare challenges. It fosters innovation, builds resilient care system, and improves health outcomes. When we talk about public healthcare professionals, they must be open-minded and proactive. It encourages research and creative problem solving. We give an example of COVID-19. During the era of COVID-19, we realized that all health workers, all scientists, policymakers, and even government as a whole, they started working in real time. Everybody was on their feet. So I want to say here that as public health practitioners and leaders of tomorrow, we must know that we will grow from strength to strength. And you must be just acquiring, it's not just being acquiring the knowledge you have gotten in this university, but it means that you should go on to have an open mind to everything that leads to innovation and impact. What are the strategies for embracing the unknown in public health innovation? There are various strategies I have tried to lay out here. Encouraging innovation, collaboration and partnership, which is very, very important. We can't do it alone. Taking calculated risk. You must be ready to adjust to response and to change. Encourage feedbacks and continuous learning. Proper data monitoring to guide timely interventions. And then ensuring health equity among others. Training of health workers to manage risk and adapt to rapid change. Utilize AI. We realize that now we are in the modern age. In fact, anybody that doesn't know how to operate the computer now will just be lagging behind. So artificial intelligence has really come in to stay. mobile innovations, digital health platforms for early detection and intervention, advocacy for policies that will protect innovators from excessive risk, provide funding for promoting new ideas and institutional support. Now, what are the benefits of embracing the unknown? We realize that it leads to more efficient use of resources and standard service delivery. It fosters creativity and problem-solving skills. It improves better health outcomes, knowledge sharing, and effective collaboration. You see, I keep repeating collaboration. It's very, very important. And increased confidence, resilience, and being open to new ideas. It will allow for more research and data-driven decision-making. I want to encourage the inductees this morning. As you go out into the market, ensure you are involved in research, because research is still the mainstay when it comes to healthcare, standard healthcare delivery. It helps to address complex challenges such as public health crises and social inequality. It promotes equity and fosters inclusion. We realize that it provides new innovation, opportunities, and discoveries in various fields of health. Why innovation matters? Why do we need to innovate? There are several innovations in public health, helping to reshape the health challenges and preventing these challenges. The first one is digital health and technology. We realize that we now do telemedicine. We now have mobile health apps. I have a colleague in Lagos who is an oncologist. She has an app. She has developed an app where when people go in, they are able to say their symptom. They tell them where to go for the investigations, and it makes it easier for them. They get the nearest hospital where they can be treated. And so we also have wearable devices for tracking physical activities in real time. We have people now wear devices to check their blood pressure, to do their blood sugar. So a lot of innovations are coming in when it comes to healthcare management. AI and data analysis, like I've said earlier. Genomics and personalized medicine. This is very, very important. As an oncologist, it's of great joy that we are able to now do genetic testing to know whether an individual has cancer or not. And thanks to genomics. So we are able to personalize. As public health practitioners, you will definitely go to the community. And so